Down syndrome is a genetic condition that happens when a child is born with an extra chromosome. This added chromosome changes how the baby's brain and body develop and leads to differences in physical, mental, and social development. The exact cause is not known, but it occurs by chance at conception and affects people of all races and economic levels. There's one risk factor we know of. The chance a baby will be born with Down syndrome increases with the age of the mother. What causes Down syndrome? Down syndrome occurs when a child is born with an extra copy of chromosome 21. It is also known as trisomy 21, which means the person has 3 copies of the 21st chromosome instead of the usual 2. This extra genetic material causes the health and development issues we see with Down syndrome. How is Down syndrome diagnosed? Children with Down syndrome are most often diagnosed during pregnancy or shortly after birth. There are screening tests for the mother, like blood tests and ultrasounds, that can identify markers that signal the potential for Down syndrome. There are also genetic tests, like amniocentesis, that can confirm a diagnosis of Down syndrome, but are more invasive and carry risk. If Down syndrome is suspected prenatally, there are specialists available to help parents learn more about what this might mean for their child. Sometimes Down syndrome is not diagnosed until after a child is born. In this case, there are certain common physical traits like low muscle tone and distinct facial features that signal the possible presence of Down syndrome. The diagnosis can then be confirmed with a blood test for the baby that detects the extra 21st chromosome. What are the physical characteristics of Down syndrome? Some of the characteristic features of Down syndrome include eyes that slant upward and small ears that fold slightly at the top. People with Down syndrome are usually shorter than average and have stocky arms and legs. They usually have small hands and short fingers. Down syndrome also involves some degree of intellectual disability. However, it's important to remember that each child with Down syndrome is unique and will develop at their own pace. With the right support, they can lead fulfilling lives, attend school, have jobs, participate in sports, and be active members of their community. How does Down syndrome affect a person's health? There are many medical conditions a person with Down syndrome may have. These conditions affect all major body systems. Some are very common, while others are less common. Almost half of children with Down syndrome have a heart condition that will require treatment. Children born with heart conditions are treated by specialists called pediatric cardiologists. In some cases, surgery may be needed to correct the problem. Infants with Down syndrome are at risk of sensory issues, such as eye problems that can lead to vision loss and ear problems leading to hearing loss. It's important to have both vision and hearing checked by specialists. Feeding and respiratory problems are common, especially in younger children. It's important to make your child's healthcare provider aware of any persistent feeding challenges or respiratory symptoms your child experiences. There also appear to be differences in the regulation of the body's immune system. This can lead to a greater risk of some infections. It also may lead to higher rates of some autoimmune conditions, such as thyroid problems, celiac disease, skin problems, joint problems, and diabetes. Problems with the gastrointestinal system, such as constipation and reflux, are also quite common. People with Down syndrome are at much higher risk of developing obstructive sleep apnea. This is a condition in which breathing is repeatedly blocked during sleep. Sleep studies are recommended for all children with Down syndrome to assess this risk. There are guidelines from the American Academy of Pediatrics for pediatricians to follow to make sure that children with Down syndrome get the health care they need. It's important to note that even with these additional medical conditions, with good medical care, many people with Down syndrome now live relatively healthy lives into their 60s and beyond. From first conversations to treatment, Boston Children's Hospital is committed to keeping children and adolescents healthy. For more information on Down syndrome, please speak with your primary care provider or visit bostonchildrens.org.